Hey, everybody. Thank you so much for joining us. We are excited. It is National Rehabilitation Awareness Week, and we are connecting with some of our therapy teams across the system here in Michigan. So we've got Chelsea Rizzo. She is an occupational therapist at Mary Free Bed at Covenant Healthcare. Hi, Chelsea. How's it going?
Hi, I'm good.
And then we got Matt Randall. He is a physical therapist at Mary Free Bed at Munson. How's it going, Matt?
Going great.
Awesome. So thank you for taking time to step away from some of your patients. It's cool that we're talking across the state. Let's start with Chelsea. So tell me a little bit about where in the state like you are and kind of what area of rehabilitation you work in.
Sure. So we're in Saginaw, Michigan. So I'm kind of right in the middle of the state. And I work at Mary Free Bed at Covenant in acute care. So primarily, we are the first ones evaluating the patients right after a major illness or injury that's bringing them into the hospital. So we're that first step of rehabilitation that the patient is receiving.
Awesome. And have you always worked in acute care, or have you worked in different parts of rehab?
I have. I've always worked I'll be working for 10 years as an OT this year. So that's crazy.
Awesome.
But
congratulations.
yes, I started in Detroit in a different hospital, and then I came here and I've been here for 8 years.
Awesome. And so if a patient has an injury or illness, they might be working with somebody like Chelsea first, and then they move over and they work with somebody like Matt. So tell me where you are in the state, Matt, and what part of rehabilitation in the system you are.
Yeah, so I'm working up here at Munson Healthcare in Traverse City, Michigan. We service pretty much the top of northern Michigan and the eastern portion of the Upper Peninsula. And I work in inpatient rehab primarily. So after a patient is hospitalized in the acute care, might work with someone like Chelsea, and then they would transition to another, like the next step of rehab, and inpatient rehab is one of those settings. So we work with patients pretty intensively still in an inpatient setting, trying to prep for a return home.
In these kind of conversations, I love to hear people who work in the field to define the difference between physical therapy and occupational therapy. Probably most common people hear about is PT. Matt, how would you define physical therapy for someone who's maybe never fully heard the definition?
So that's very setting specific, I would say. So in acute care or inpatient rehab, physical therapy primarily works with the big movements. So we get one of the common saying is we get you there, and OT helps you do what you got to do once you're already there. So a lot of our work is with bed mobility and transfers, ambulation, stair training, and doing those big gross motor movements that are required throughout your day.
So Chelsea, how would you define occupational therapy to somebody who's maybe never heard the field?
Sure. So in occupational therapy, what we focus on are ADLs, or activities of daily living. So everything that a patient does in their everyday life, so bathing, dressing, toileting, their functional ability, being able to transfer themselves at home, whether it be just walking like a normal independent patient, or if they use a different kind of device, a walker, cane, even a slide board. So we really focus on trying to look at the patient as a whole, and then we focus on what's meaningful to them. So what is that patient's specific goal? Even it might not be to walk. It might be just to be able to put their own socks on or something. So we just really focus on what the patient is, what their main goal and what's meaningful to them.
So Matt, what are some of the common patients and diagnoses that you see and you work with?
My primary patient population that I really enjoy working with is a stroke patients. So after they've had a stroke, helping them relearn how to walk and do stairs and transfer. But in the inpatient rehab setting, we also work a lot with patients after having an amputation, whether that's partial foot, BKA, AKA. We work with a lot of patients that have neurological diseases, disorders like MS, Parkinson's. And then the other big diagnosis that we work with is major multi-traumas. So significant car accidents, ATV accidents, ski injuries, that sort of thing.
What's been maybe some of the farthest distances of people that you worked with? You mentioned earlier that you have people from all across northern Michigan. Any like
Mhm.
towns that people might recognize from like far away that you've treated up in northern Michigan?
Um, we also have a lot of snowbirds here, so we
Yeah.
have a lot of patients that we work with from other states,
Okay.
Florida and Texas, stuff like that. Um, I don't have like a specific city,
Mhm.
in the UP that we work with people from, but kind of spread all over.
Yeah, and then Chelsea, your team at Mary Free
Mhm.
Bed at Covenant probably treat people all over the Great
Yeah.
Bay, the Great Lakes Bay region. What are some of the places you remember that people have been like farther distances that you worked with?
Farther just we actually had a patient come in for an elective joint from Texas. So that
Mm.
was interesting. They came specifically for that surgeon, and we had to figure out how to get him safely on an airplane home.
Okay. Oh man. And that's the world of rehab. It's like it's so custom to what patients need that
Yeah.
they have a goal, they tell you about it, and then you guys figure out a way to make it work. And that's just always so great to hear. What about you, Chelsea? Is there, besides like amputations or recovering from
Mhm.
elective surgeries, what are some common things that you and the team see?
Sure. I actually primarily work on our orthopedic and neurosurgery floor. So I
Mm,
do see a lot of like our elective joints. So the total hip patients, total knee, shoulders, but then also a lot of trauma as well.
mhm,
So like Matt in the inpatient rehab, I work with a lot of those patients that usually go over to inpatient rehab afterwards. So, but in acute care, we have a vast array: cardiopulmonary, we have a neurology floor, we have 3 ICUs here, surgical, cardiovascular,
mhm.
and then we also have an oncology floor and pediatrics. So we see a lot of different kinds of patients here at Covenant.
So, Matt and Chelsea, what's it like the having those conversations at the beginning with a patient where they're maybe sharing their goals and you're like assessing them? How do you come up with your plan to then figure out, okay, this is what you want to do, and these are the steps we're going to take to try to get there? Matt, if you want to go ahead.
Yeah. So all of our patients are so different. We work with, like I said, we work with people with so many various reasons for being here.
Mhm,
But ultimately, the main goal tends to boil down to wanting to get home.
yeah.
So during our evaluation process, we talk about what are those barriers that you're going to run
Mm-hmm.
into, whether it's you have stairs to get in, or your doorways are narrow, or whatever the barrier might be.
Hmm.
We really dig into those and try to figure out what we're going to have to do, whether it's what the patient's going to have to physically be able to do, or what sort of modifications we're going to have to make, or help them get resources to make, to be able to achieve that goal of returning home.
And for you, Chelsea, it might be
Mhm.
returning home, but also it could be the next step in their recovery, right?
Definitely. As I was just going to say the same about Matt. Usually it's like, what is your goal? What do you want to achieve here? And it's always usually to go home. So
Mhm,
even if that's like tomorrow for in the acute care world, or it may be 2 weeks or like a month, and we have to talk
mhm,
about different options for discharge. So we do a lot of the discharge planning, like assisting with the case management team, the
mhm.
physicians here, and trying to figure out what the best plan is for these patients. But most often it's like, I just want to get home. So
Yeah.
if that's assisting with adaptive equipment, figuring out how they can do things just a little bit differently than what maybe they're used to, just so they
Mhm.
can get home in a safe fashion, then that's what we deal with a lot of the time here in acute care.
What I love to talk about is the goals, but also how the teams really work together. It's not just the physical therapist going on their own doing their things. You guys are
Hmm.
collaborating with the team. Tell me about that kind of multidisciplinary approach. And Chelsea, I'd really also like to kind of
Hmm.
hear about that on the acute care side too.
Yeah. We actually just started, we do multidisciplinary rounds every day on
Mm,
each of our floors now in the hospital. So we have physicians, we have nurse practitioners,
mhm.
PAs, and we're all sitting in on one group together, which is great because then we all are on the same page about what this patient's needs are,
Yeah.
and then also what their goals and what the family is needing as well from this. So, yeah, we are constantly talking and collaborating with other disciplines in the hospital.
Yeah. What's that like for you, Matt, within the Mary Free Bed at Munson team?
Yeah, I'm going to echo a lot of what Chelsea said.
Mhm.
Um, Being in the inpatient rehab unit is, just by sheer size, is on the smaller end of the spectrum. So I can walk 40 feet over and go talk to the OT that I'm working with on a patient. I can walk another 20 feet and talk to the case manager, and another 10 feet and talk to the doctor. So having everybody in a close proximity really fosters that relationship, that multidisciplinary team aspect. And we can all work really closely together to help the patients achieve the goals that we have set for them.
And speaking of goals again, any like unique like milestones or success stories you've had recently with some of the patients you've been treating?
Yeah, there's one that specifically comes to my mind, and it's not necessarily recent, but about a year ago, we had a patient, and I don't want to go too long-winded, but he's a pretty independent guy, not without some health deficits, but he was just working hard one day and fell out of the back of a pickup truck and had some fractures in his spine and ended up having some spinal surgery. Came to inpatient rehab, and we worked with him for a while, but ultimately got him functioning to a point where he could go home. But he was having a lot of pain, and he was utilizing a walker. Last week, he came back in just to say hi to all the therapists that helped him along his journey, and he looked great. He was walking, no walker. He was back to living his life, doing his active thing. And it was really, really cool to see what I would consider a success story.
Oh yeah. There's big success stories. There's little success stories. There's tons of success stories within someone's journey. So Chelsea, what about you? What's been a success story that you've seen?
So I was going to kind of say similar story to Matt's a little bit. I had a patient, but he was in a car accident, and he was in our ICU. He had a multi-level spinal fusion because he had so many fractures in his spine after this, and he was very independent but very reluctant also to work with therapy initially because he was very fearful of the pain, but also of like his limitations that he may have. So that's one thing in acute care. You have to build trust very quickly with these patients. Because we're only seeing them, sometimes it's 1 to 2 times before they do go to their next discharge placement or to inpatient rehab or somewhere. So we built that rapport, built that trust with him quickly, and he actually blew us out of the water. He did so well. He was like, I don't even know if I can sit. And then all of a sudden he's walking, 10 feet with just a little bit of assistance. So sometimes in acute care, when you're in the ICU, just those like small mobility moments are those big milestones for those patients.
Love to hear it. As we're starting to wrap up this conversation for National Rehabilitation Awareness Week, talking to some of our team at Mary Free Bed at Munson up in Traverse City and Mary Free Bed at Covenant in Saginaw. I want to ask you both, like, why should we be taking this week to celebrate? We do it on site and our teams are celebrating amongst ourselves, but why should like the general public like be thinking about rehab and be celebrating as well? Matt, do you want to take this first?
Sure. I think is the best reason just to highlight the great work that all these therapy teams do to help patients. A lot of times patients come to us at some of their lowest points, and we help restore that hope and that freedom and that independence really to their lives. And then additionally, traditionally, I feel that people think about a PT or OT in the outpatient setting. And they don't necessarily know about the inpatient side of things, acute care or inpatient rehab side of things until something does happen in their lives. They have a catastrophic injury or accident or illness. And so I think getting the word out on the different settings is super crucial. Thanks, Chris.
Chelsea, you want to help wrap us up?
Yeah, honestly, I was going to say about the same thing, just spreading awareness, because you don't know what it is, honestly, until sometimes you have a personal experience with therapy. But also just that the therapists that I work with, and I'm sure Matt also does, we just care a lot. So I think it needs to be celebrated because we put so much physically and emotionally into these patients, and we're just hoping that they get a little bit of that back in their recovery process. So it deserves to be celebrated.
Love it. Okay, awesome. Chelsea and Matt, Mary Free Bed at Covenant and Mary Free Bed at Munson, thank you for checking in from across the state to celebrate National Rehabilitation Awareness Week. It's going on all week here. We'll be back with hopefully another video to talk more with other members of our team across the region. Thank you so much for watching, and stay well.